Good morning, everyone. Today we are going to take a class on salivary gland disorder. So here is a classification. Classification comes first is a non-neoplastic classification. Comes as a developmental disorders such as aplasia, agenesis, hypoplasia, aberrancy, atresia, diverticuli, accessory duct, and fistula, and Stephane cyst. It's a developmental cyst which is seen on the lingual submandibular salivary gland depression. So you can see in the radiograph just below the mental foramen, you can see the Stephane cyst. Okay, the second one. Second classification is reactive or inflammatory lesions. So comes under mucosal. That is mucosal again divided into two. That is mucus extravasation cyst and mucus retention cyst. And third one is ranula, plugging ranula or necrotizing silometaplasia, which comes under the ranula, and silolithiasis. So which comes under the reactive or inflammatory lesions. So this is the diagrammatic representation of the mucus cyst. So there is a mucus plug. You can see over there is a mucus plug over here, and there is a retention cyst, and you can see the leaf-like appearance of the salivary gland. So this is a ranula. Most of the time it is a sublingual affecting the sublingual salivary gland, and most of it is a flat belly appearance. So it is a fluctuant mass seen on the lower part of the tongue, and difficulty to opening the mouth, and dysphagia is the main characteristic feature of ranula. And infection was broadly divided into two, that is viral and bacterial infections. So viral infections comes as mumps, cytomegalovirus, Coxsackie-virus, HIV, etc. And the bacterial infections, the non-specific, such as acute and chronic, specific, that is tuberculosis, syphilis, actinomycosis, etc. So granulomatous diseases, the fourth classification comes under granulomatous diseases. That is sarcoidosis, the evaporative, the Hereford syndrome, and Wagner's granulomatosis. So evaporative fever is the inflammation of the tract of the eye and the parotid swelling and the facial palsy. This is Capsis syndrome, and it's a form of the sarcoidosis. And the fifth one comes out the metabolic disorder. So basically, cirrhosis or siladenosis. Siladenosis, that's basically it's categorized into hormonal deficiency, multinutritional deficiency, chronic alcoholism, and drug-induced metabolic disorder. The sixth one is an immune defect. Due to the immune defect, that is basically two. One is Sjogren syndrome, and is a benign amyloid lesion or macular disease. Basically, two immune defectors, autoimmune disorders such as Sjogren syndrome and macular disease. And salivary gland neoplasms is basically divided into two. That's benign and tumor, benign and malignant. And benign comes as a pleomorphic adenoma, monomorphic adenoma, the Watten's tumor, basal cell adenoma, canalicular adenoma, oxyphilic adenoma, myoepithelioma, and ductal papilloma. So malignant lesions, such as malignant pleomorphic adenoma, adenocystic carcinoma, mucoepidermal carcinoma, and arsenic cell carcinoma. This comes under the salivary gland classification. And moving over, this is the Stephane cyst, which you can be seen. And this is a mucosal. This is a clinical picture of a mucosal. And this is a clinical picture of a ranula, and this is sublingual swelling. And see, this is like a look like a font belly appearance. You can see there is a font belly, the same like kind of clinical appearance you can see over here. And moving on to the individual lesions, first one is the side of the